This is my Ostomy Care Lab. So first thing, I want to check my doctor's orders, make sure all the patient information is correct. So Ostomy Care Daily, PRN, so it's been indicated it's needed, so off we go. First thing, I'm going to just make sure I have all my supplies with me. So I have my new ostomy pouch, my clip. Okay, I've got scissors, I've got my measuring tool, I've got ostomy paste, and I've got all the clean towels and washcloths I need. Alright, so I'd head off to my patient's room. So hello, my name is Monique. I'll be your nurse today. I'm going to provide privacy. I'm going to close all the curtains, make sure the patient is comfortable with their surroundings. So can I please get your full name and date of birth? And I'll check their bracelet, compare it to our doctor's orders here. Okay, Roger Stevenson. Okay, February 2nd, 1950. Okay, wonderful. So we're just going to go over with Mr. Stevenson. Do you have any allergies, Mr. Stevenson? No? Okay, great. Your vitals look good on your chart. No known allergies. Is there anything else we should be aware of, Mr. Stevenson? Okay, so today we're going to be removing your old pouch. We're going to be assessing your skin and your stoma. We're going to be replacing with a new pouch. And do we have permission to continue? Great. So I'll be doing my hand hygiene. Right, and applying new gloves at this time. So I can go ahead and put my rails down. Okay. So we're just going to do a quick assessment on our patient. So I'm just going to look at their stoma. Their appliance that is on it already. We're going to see if there's any leaks. It was indicated in the scenario that there are leaks, so we're going to be very aware of that one, especially when we're opening it and disposing of it, that we're just very careful because it's already leaking. So we're going to want to make sure our patient is in the semi-Fowler position, so that's about that 30-degree angle. Right, so make sure our bed is where it needs to be, comfortable working height for me. So we'd go ahead and just start by placing a towel under patient. So that. We're going to drape a towel over their abdomen as well, so nothing's getting dirty. Okay. So at this time, then we go ahead and remove the old pouch. So I'd be careful to take it off very slowly. Again, if there's leaks, we gotta be very aware of that and clean as we go. If it's very stuck, we're gonna wanna have to use a adhesive remover spray or whatever we need to get it off without hurting the patient or their skin underneath. So I've got my full 30-fold pouch here. I'm gonna take a warm washcloth at this time. I will put it over the open stoma. I will take my old pouch. I will take it to the washroom, empty it. I'm going to be sure to measure it if it's necessary. I'm going to be sure to put it into a biohazardous bag after. I will then also dispose of my gloves. At that time, I'm going to do hand hygiene again. I'm going to put some new clean gloves on. Alright, so here I am, back at the patient. My rails down again. I'm going to have my clean washcloth, and what we're going to do is we're just going to wash around the stoma. We're going to be very gentle. We're not going to scrub. We're not going to pull. So we're going to be very light dabbing. We're not going to use soap either, which is also an irritant and will compromise the adhesive putting back on. Alright, so our stoma wants to be a deep pink color. We want to look for skin breakdown, especially since there was that leak. We want to see how they're doing on the pain scale here at this time too, because in the scenario it says they have about 6 out of 10 pain. Has this been addressed yet? Do we need to get an order going for pain meds? What are we doing with the pain? Okay, so we'll just keep talking to our patient, walking them through it. We have our measuring tool here, so we're just going to go ahead and measure our stoma. Alright. So, okay. So 1 1/4 inch was good for us. So put my rails up. So I would go ahead, get my scissors. I've got my 1 1/4 inch. We're gonna measure it, but we're gonna want to make sure to add that 1/8 of an inch on here, just so it's not irritating the stoma at all, yet still a good snug fit. So I'd go ahead and I'd cut that wafer as I need it, and I would trace it as well, obviously. Trace and cut. Okay, so once that's done, we can go ahead and use our ostomy paste at this time too. On our clean stoma, we put the paste around just to give it that good extra protection. We would remove the adhesive backing at this time on the wafers. And then we could go ahead and just stick it right on our stoma. It should be a nice snug fit, yet not touching the stoma, so it's not irritating it. We'll get the patient at that time to kind of use their own body heat, their own hands, just to hold it down, just to melt it, the glue, to their own skin, just while we're preparing other things. So then we would take our pouch here. We go ahead, once that's sealed nicely to the body, I'm going to make sure it's clipped into place. Again, using that Tupperware kind of analogy, just slowly, carefully, trying not to put too much pressure on the abdomen there. We're going to go ahead, we're going to make sure that there's no leaks, it's sealed very well possible. And then we're going to want to make sure, got our clip here, that it's hugging the patient so the clip won't irritate it. Clip it up. It's always tricky when they look. We're going to make sure that's clipped super well because we don't want it leaking everywhere. Okay, so at this time, I would just gather all my dirty linens and get rid of them. Dispose of them in the receptacle. Okay. We're going to make sure our patient's feeling good. If they're not, how can we help them feel better, more comfortable? We're going to make sure they're where they want to be. Are they okay in this position? Do they want their bed back down? Whatever. We're going to make sure the rails are up before we leave the bed. I'm going to dispose of my gloves as well. I'm going to perform hand hygiene at this time. So, Mr. Stevenson, are you good to go? Are you feeling comfortable? How's your stoma? Are you needing anything at this time from me? Okay, make sure they have access to the cowbell. So then at this time, we take all our stuff with us as we go. And then we can go ahead and we can document. So when we're documenting, we want to note the amount, consistency, and the color of the stool that we had disposed of. So we'll be sure to write that all down. We want to document our stoma assessment as well. So the color of the stoma, any skin breakdown around the stoma, if there was any bleeding, anything like that. And then our evaluation. So we're going to monitor for pain improvement. So either, like I had said, we would have ordered some meds or we're on it, trying to get that done for the patient. We're going to come back around, see how they're feeling, see how that ostomy appliance is feeling on them. And further pain management is needed if they need anything else. Otherwise, they should be good to go.